motion is the best thing you can do while in labor. It really, really, really helps to engage the baby in the proper position, to come lower into the pelvis. It like you've probably seen in some of my videos, I show all the kinds of fun positions that make people laugh, but it is truly the best thing you can do when you are in labor is to move.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. This week's reviewer of the week is Shell XOXO9, who says, "Thank you. As a mom who's endured 6 previous back-to-back miscarriages, listening and being informed on pregnancy and labor is preparing me for our thriving baby we are about to welcome to the world in September. I'm so blessed to listen to these stories and information I need." Thank you so much for that review, and I hope you're going to enjoy today's episode as well. I kind of love when I get to have professionals on that get to do this in the daily and break down all of those questions, those burning questions that I know all of you guys have. If you haven't left a review yet, you can do that at Apple Podcasts. You just find Pregnancy and Birth Made Easy, scroll down to the bottom, hit those stars, and leave us a review, and I would love to read it on our show. Now, for today, I have with me Nurse Sydney. She is incredible. I will dive into why in just a sec, but she is a Canadian labor and delivery nurse from Toronto. She shares educational and entertainment content about pregnancy, delivery, postpartum, and newborn care, and she loves supporting women and giving them tools to advocate for themselves and for their newborns. Now, I just got lost on your Instagram page a little bit ago, dying laughing. You have several things on there that are so fun. I want to give you a chance to introduce yourself, but I will let you know that the last thing I watched was you going around. It must have been like, I don't know if it was Christmas or some holiday or some reason that you were all together with your family and you were like, "Hey, how many is 5 centimeters? Hold your fingers up. How many is 10 centimeters? Hold your fingers up."
Oh, yes.
I was like, this is awesome. You also had some Drake song that you were doing. And anyways, that one was a killer too. But that was so fun. I love that you're like involving your whole family in it too. So your content is killer.
I love involving my family.
It's so fun. I love it.
Thank you so much.
But it's also super educational. So you're like fun to watch and it's entertaining, which is so cool. But tell us a little bit about you. Is there anything, I mean, those were your professional things, but like what about your life and who you are?
Yeah. So I'm Sydney. Obviously, you guys she introduced me super well. I've been a labor and delivery nurse for about 4 years. So I graduated right kind of when the pandemic started. And
Oh, wow.
I went straight into postpartum. Yeah. I went straight into working in the postpartum unit. I knew I wanted like women's health forever. I've always loved working in women's health. So I went straight into postpartum and then I cross-trained to labor and delivery shortly after that. And then I've been there ever since. I've worked at a few different hospitals, but I absolutely love what I do. I love labor and delivery. It is my passion. It is just every single day working as a labor and delivery nurse is so amazing, like getting to see babies being brought into this world and seeing women like so powerful and strong throughout. Oh, it's just every single time I see it, I've seen thousands of births at this point, and like every single time it is still so special. So I love what I do. And then I also started posting online just kind of for fun. I was kind of bored when I was off my rotation, and I saw a video on TikTok once that was like, what to pack in your hospital bag. And I realized I was like, I know exactly what you need to pack in your hospital bag. I'm a labor and delivery nurse. Like, I see people come with like tons of stuff and I see people come with not enough stuff. So I was like, I'm going to post a video about that. And it went viral. And then since then, I've just been continuing to post stuff online on Instagram, TikTok, Facebook, and hopefully helping a lot of new mamas out
Yeah,
there.
I love that. Tell
Yeah.
me a little bit about how you got started in this
Yeah.
because as I understand right now, you don't have any children. Is that correct?
No, I don't. I am not a mama yet. I'm just a fur baby mom.
I
Just
love
have a
it.
little doggy, but yeah, I'm not a mom yet. I hope to be one
Yeah.
day, hopefully. But yeah, I honestly just always loved babies and always had that really strong maternal instinct. Yeah, I always loved it and I've kind of found like working in labor and delivery was just kind of a way for me to feel those emotions and be with the babies, be with the moms, and I absolutely love it. So hopefully one day I can be I can be a mom as well. I'm getting married next year, so I'm excited to start that journey hopefully soon. Yeah. Yeah.
That's so exciting. Well, an early congratulations because that is such a fun part
Thank
yeah,
you.
like a start to your life. That's so
Thank
cool.
you.
But I love what you do, and I love when women are passionate about
Yeah.
it from the start. I did not get into it until after I had my babies.
Yes.
I didn't think about it at all, and I absolutely love it. I think women are called to the work, and you're clearly one of those women, which is just awesome.
Yes.
So glad to have you here. Glad for what
Yeah.
you do. And I know you're going to be a wealth of information for all the listeners today. So, speaking of this like viral video, let's talk about that. What do you pack in a hospital bag from a labor and delivery nurse perspective?
Yes. Oh, I love this question because it's something that I find a lot of women kind of stress about when they're getting ready those last few weeks. It can be a lot, right? You're like, what do I need? What don't I need? Truly, you don't need a whole lot. I always say, check with your hospital or birthing center wherever you're delivering and see what they actually provide. Sometimes they have an actual list of things that they recommend that you pack. So you might be able to get this from your obstetrician or midwife, whoever you're delivering with. But basically, you want to just have a lot of stuff that make you feel comfortable. So when you're staying, in a place that's not familiar, so you're in a hospital, you're scared, you want some things that are going to make you feel more comfortable. So whether that's like literally a blanket that makes you feel more comfortable or some fuzzy socks or anything you can think of, even like your favorite pillow or some comfortable pajamas, that kind of stuff. I always recommend bringing it because it's just going to make you feel a little bit more at home while you're in the hospital. And then in terms of things like bait for baby, you don't actually need a whole lot for the baby. The hospital provides almost everything. But I always say you want to pack like a couple going home outfits just because you don't exactly know what size baby's going to be. Most of the time they fit in newborn sizes. But bring a couple, but you don't need to bring a whole lot of onesies because majority of the time that you're in the hospital, they're going to be skin to skin, or the labor and delivery nurses and postpartum nurses are going to be coming in and doing assessments on the baby and undressing them all the time anyways. So you really don't need to bring a whole lot for the baby. We usually have a lot of diapers and that kind of stuff. In Canada, actually, we don't provide wipes at most of the hospitals I've worked at. I don't know why that is, but so I always say bring some wipes because it's a little bit easier for those diaper changes, especially with that sticky meconium the first few days. So, having a couple of diapers, couple wipes, but the hospital provides almost everything you're going to need. So, yeah.
That's awesome. How about I know like so I feel like definitely with the stuff that you share, you're like more on the like natural side of things. Like let's trust the process, let's trust mom, let her intuition, how she wants to move and feel and all of that kind of stuff. So for moms coming into a hospital setting, what are some recommendations that you would have for her in the way of what she's asking for or what she's doing during labor?
Yeah, so I'm a strong advocate for having a birth plan in place or at least some kind of idea birth preference list. It's good to be prepared for the expected and the unexpected, but it's also important to have researched things ahead of time so that what to advocate for yourself while you're in the hospital setting. And I always say it's also important to involve either your partner or, some kind of birth support person that you're expected to be there. So if it's your mom, your sister, your best friend, and include them in your birth preference list so that they're also able to advocate for you while you're in the hospital. Because when you're in pain, when you're nervous and you're scared and you're in an unfamiliar environment, it's hard to advocate for yourself. So make sure you have people around you, even a doula. I'm a huge support for finding a doula if that's something you can get your hands on and you can afford, but just having those people there who can advocate for you as well will really, really, really help. But yeah, the hospital, like, we're here to support you no matter what your decisions are. I always like to remind people too that, like, even if you're delivering in a hospital or in a birthing center and the doctors, the nurses were telling you so much information, at the end of the day, you're still in charge of your own body, your baby, you're in charge of everything. We're just here to make sure that you make an informed decision and that, you stay educated on what we usually recommend, what best practice is. But at the end of the day, if you don't want to do something, it's completely up to you. It's your choice at the end of the day.
So, how would you recommend that women find providers such as yourself? Because and I agree with you 100%, but I do find that
Yeah.
oftentimes women run into kind of sticky situations where they feel like it's almost a fight or they're being coerced into things. So, do you have some recommendations for communication between you and your nurses or your providers, or kind of how to vet them before?
Yeah. So, I mean, again, that's kind of challenging because even if you choose an obstetrician or, a midwife that you really align with ahead of time, it doesn't necessarily mean that they're going to be on call when you deliver your baby. I usually say if you can kind of get to know, like, do some research ahead of time. There's a lot of things online saying, like, in your area who's recommended, who's not, before you actually go with an obstetrician or a midwife ahead of time. You could do a little bit of research and then have those conversations with them at your prenatal appointments. Ask them, like, who their colleagues are and what their expectations are for when you go into the hospital. And if they're not going to be the ones on call, how to go about that. They might have some advice for you. It's hard because you can get matched with some absolutely amazing, like, super, super great providers and nurses. And then every once in a while, you can get matched with someone who just doesn't fit with you and what you want. You do have the right to ask for a different nurse if that's the case. Sometimes doctors, there's usually only one on call. So that becomes a little bit more challenging. But with the nurses, we do have, like, quite a bit of nurses on like in one rotation. So you can ask, it's we won't take any hard feelings against it. It's not like, sometimes people don't mesh, and if you want to try someone else, just ask to speak with the charge nurse and we can totally do that. So that's something that you can kind of keep in mind as well.
Yeah, I like that. How about for moms who, like, I know we recommend, like, if you can take a hospital tour, and some have been open and some have not. Some take you on internet tours now and whatever else. But I think if you can get into the hospital and see and feel the space, I think that's really great. Are there any questions that you recommend that mom bring with her to help her know if it's the right setting for her, or what she's going to have to advocate for, or what is going to be just naturally there?
Yeah. So, I mean, again, this is very personalized depending on what exactly is important to you. I think a lot of women, there's some women who I've had who've been only wanting a female provider. So that's a question you can ask ahead of time, is like, who's on the call team? Because usually, for example, with midwives, there's usually three of them or more who rotate their call schedule. So you can ask and be like, is it all females, and ask those questions ahead of time and just see what it's like, see exactly what fits for you, what doesn't. Some other things that you can ask ahead of time are probably like, trying to think, maybe exactly like who you can have with you as well. So can you have multiple support people with you? I know during COVID that was a huge thing. You could usually only have one person with you. Most of the times nowadays, we're pretty flexible with how many people you can have, but I know this depends on different hospital policies and stuff like that. So if you can ask that ahead of time as well, that might make you feel more comfortable and be able to, prepare ahead of time of who exactly you want in the room with you and who you don't, and what visitors can come and go.
Awesome. How about birth plans? I know this is a big thing. You kind of talked about birth plans, birth preference. Can we kind of dive into birth plans and how nurses use them and what information you find really helpful to be on there? What gives it a little personality, or how you can relate to your providers when you come in?
Yes. Yes, I love birth plans. I really think it's something that absolutely every patient should do just to be prepared. Again, it's kind of one of those things like you can't have a strict yes, no to everything, because at the end of the day, birth is very unpredictable. It's gonna be what it is. And I always say it's
Yeah.
almost like the first glimpse of being a parent, because as you know, I'm sure, like you have no control over what happens with your kids. Like it's you have to be able to be okay with the unpredictable, and birth is just that first kind of step into that. Of course, you can prepare ahead of time and have things that are extremely important to you, that no matter what you want at the end of the day, and include that on your birth plan. I also say include like your support person's name, if you know the gender of the baby or not, things to kind of make it a little bit more personalized. And then also include what makes you feel more comfortable. So if you're really planning on having an unmedicated birth, what tools do you have in place, or what things would you like as an option? So do you want, the availability of a shower or a bath, because some places don't actually have baths in every single labor room. I know mine specifically, we have one bathtub. So that's kind of something that we can put you in a room with those things ahead of time if we know. And then, do you have a doula with you? What's their name? Just so we can have them there as well. And then also, do you have a TENS machine? All these different things that we won't necessarily know if we should offer, if you do want to have an unmedicated birth, or you want to have a medicated birth. If you want to have an epidural like at 1 centimeter, we can also do that. We can have those conversations ahead of time, but we need to know that. So it's really good to have those things on your birth plan. So pain management is a huge, huge thing, because birth comes with pain. Like we all know that. It's amazing, but it does come with a little bit of pain as well. So how are you going to manage that pain throughout the labor and delivery process? Or what exactly would be your absolute gold standard of, this is exactly what I want? And then also have on there, what if the unexpected happens? So let's say emergency C-section. There's only two ways to have a baby. It's through your vagina or through a C-section. Like you have to prepare for both, because at the end of the day, it's always on the table. Even if you're 10 centimeters dilated and pushing, it is still a possibility. And, it's good to prepare for that. So what exactly do you want in the case of an emergency C-section? Do you want someone with you in the room? Do you not want someone in the room with you? Most of the time people do, but it's just good to have that in place. And, some places offer a more natural, or what you want to call it, C-section, where they have a clear drape, or you can actually see the baby right after. They hold the baby over the drape for you, or they do that 1 minute of delayed cord clamping during a C-section as well. I know that that's a large movement that they're trying to do with every delivery, as long as it's safe. So that's something that you can have on your birth plan as well. If you want to do skin to skin in the operating room, if you're feeling well enough, that's something that you can put on there, because it's completely possible to do that as long as you're feeling good. Another thing is having someone there who can do the skin to skin on your behalf if you're not feeling well, because sometimes during C-sections, you're not feeling your best and you need to wait until you're in the recovery room. Another thing that you can put on there is, if you want the measurements of the baby and the weight and all of that to be done after you're out of the operating room. That way you can be a little bit more a part of it. I think that that's something that's good to think about as well and have on your birth plan. And then last but not least, there's a lot to go into with the birth plan, but I also want to say it's important to include postpartum as well on there. I think a lot of people think, okay, birth plan, it's just what I need during the labor and delivery process, but it also should include your postpartum wants and needs on there as well. Are you planning on exclusively breastfeeding? Have you hand expressed some colostrum ahead of time and you have that stored? That's good for your nurses to know. Who do you want in the room with you as well? Because I know postpartum, we get a lot of visitors asking to come and see you. And sometimes people want all kinds of visitors and sometimes people don't. And we're okay to send people to the waiting room if that's the case. So it's good for us to know that too. And what are your plans? Like, do you have something in place for the pain management postpartum as well? Because that's something that can happen, especially after major abdominal surgery, which is a C-section, you know? So do you want that bath at the 24-hour period, or do you want it sooner? Do you not want your baby bathed at all in hospital? There's all kinds of things to think about postpartum as well that I think is really important to include on there.
Yeah, I'm glad that you mentioned that. And I absolutely love that as a labor and delivery nurse, you said make sure that you plan for the unexpected, because when it does come, you don't want to feel it makes it so much harder to work through or scary because you don't have a plan in place. And so I'll make sure we actually have a couple of downloads, and I'll put that in the show notes for the customizable birth plan. And we also have kind of what you were talking about, like a gentle cesarean plan. Like, here's all the options that you can ask for. What do you want? And then tuck it away. Like, take it with you to the hospital. But
exactly.
Now you don't have to stress about it or worry about it, because and you know that you have it there to hand to somebody. Along with that, when is a good time to give your birth plan when you come into the hospital? And how many copies should you have? Who do you hand it to? What does that look like? And who do you discuss it with? Is it your nurse? Is it your doctor? Is it both?
Yeah. Yeah. I know some providers who actually really like when the patient brings the birth plan into their prenatal visits, and sometimes they go over it ahead of time. So that is an option. But you don't have to do that. If you want to just have it ready to go with, your hospital bag, you have honestly, you really only need one copy, maybe two, just two or three, like a few copies. Because what we usually do is we'll photocopy it and then we'll put it at the very front of your chart so that everyone who's involved in your care sees the birth plan right away is the first thing that we see. So when you come into triage to be assessed, if you think you're in labor or you have a scheduled induction or anything like that, give it to the nurse that you first come in contact with, and we'll put it into your chart right away. So that's kind of the best thing to do. That way, everyone who sees you from that point forward will have an idea of what your birth plan looks like and exactly what you do and don't want. So I think that that's the best way to do it. But if you want, bring it up with your providers ahead of time as well. That's totally fine. Whatever you feel like is best for you. Oh, honestly, I love thank you cards. I know it's like the most generic, easy thing, but just like a card with, your name and your baby's name, if you have it on there, that's the best gift you could possibly give. And I usually say include the date on there as well, just because we have a lot of patients, and sometimes, it gets a little bit blurry, and it helps me to remember, okay, that's when they delivered, or that's when they came in. And then I can kind of narrow it down in my head of who it was. And I keep every single one of my cards. I have a book that sweet. I put them all in. Yeah, I've been collecting them for over the years, and it is so when I've coming home and I've had a bad day, sometimes I'll pull out that book and just read through it, and it just warms my heart, and I love it so much. Another thing that I had a patient recently do was she actually didn't give me the card before she left, but she sent it to the hospital a couple weeks or months. I can't remember, but I think it was a couple weeks after. And she included a picture of baby afterwards. And I loved that because I got to see how baby's growing, because, usually as a labor and delivery nurse, we send our patients home with their newborn baby, but we don't really see them until maybe they come back and have a second or third or fourth baby. So it's really, really lovely to see how baby's growing, and just, I absolutely love that.
I like that a lot. How about, okay, I have just like random questions that people have asked that I'm like, I definitely want to make sure to ask these on here too. One of them had to do with oftentimes, and especially when we're talking about epidurals, you get stuck kind of in that laying down position. But without an epidural, what are some of your favorite positions that you like to see moms do, or you recommend that they do during labor? And also, if they have an epidural, what are some things that they can do to really utilize the workings of that epidural in a positive way that continues to progress labor?
Yes, I love this question because labor, like motion is the best thing you can do while in labor. It really, really, really helps to engage the baby in the proper position, to come lower into the pelvis. It like you've probably seen in some of my videos, I show all the kinds of fun positions that make people laugh, but it is truly the best thing you can do when you are in labor is to move. So, there's all kinds of different positions you can do with the peanut ball. I'm a huge advocate for the peanut ball. I love, love, love the peanut ball. If any of you guys don't know what it is, it's basically this big, big ball in the shape of a peanut, and it goes in between your legs. And that one you can use a lot if you have an epidural. So that's one of those positions that you can easily do with an epidural, or if you need a more restful position. So let's say you've been on your feet for hours and you're getting really, really tired. You can lie on your side in bed with the peanut ball in between your legs. And we have a couple fun positions we can try that most labor and delivery nurses or midwives know about. So you can use the peanut ball, and most hospitals nowadays too, we have the peanut ball. So you don't need to come to the hospital with it, but that's something you can ask ahead of time as well. But my favorite thing to do if you are in early labor and you don't have an epidural yet is to honestly use a birthing ball, sit on it, move your hips, go in circles, side to side, that kind of stuff, or just to do some really low, deep squats. That's another thing that you can do. Hold on to the bed and just kind of squat down really, really low. Be on your feet, walk around as much as you can, as much as you feel comfortable, and then still include those restful positions in between. But being on your feet and squatting, hands and knees, all of those kinds of positions are just so powerful during birth. It really, really helps to engage the baby in the proper position, which can be really, really huge. Like baby being in the right position can take you from pushing for 20 minutes to 3 hours. So it's important for baby to be in that right position. And if you can do everything you can to kind of facilitate that, then why not, right? Why not give it a try? I also wanted to kind of put out there that with an epidural, it is still possible to do a lot of different positions. I think a lot of people think once they get the epidural, they're kind of stuck being flat in the bed and not doing anything. And that's not necessarily true. If that's what you want and you don't want us to touch you, we can totally do that too. But we can also move you. Some people have a more dense block, so they have a higher epidural that completely numbs them and they can't really feel anything. And then other people have a little bit of a lighter epidural where they can actually move. That's considered the ideal epidurals, when you can still have a little bit of movement, but you're not feeling the intense pain of the contractions. So there are things we can do if you have a really dense block. We can actually turn down the medication as well if that's something you want to explore a little bit too. But I have gotten lots of patients with really, really dense epidurals into hands and knees position, side lying, all kinds of stuff. And sometimes you just need a couple extra hands in there, like, grab your support person and we can get you on your hands and knees and make sure, you're still safe, but it's totally possible. So don't take that out of the question if you do want an epidural, but you still want the benefits of motion in labor, because it's still possible. It really is.
So you mentioned how you are, helping women do all these different things during labor, even though you have more than one patient at a time, I assume. How can women utilize their nurses? What can they ask them for to help them along during their labor?
Yeah. So number one is tell them ahead of time that you want to use the peanut ball, or you're interested in doing lots of different positions, because they can go and grab some stuff for you to have so that you have it. If we're running in and out of the room, you at least have it. A lot of people also, or a lot of hospitals have guides, so that we actually have like a guide of different positions that you can try while you're in early labor. So that's something we can give you ahead of time, or you can actually look up too. There's lots of positions online you can look up, but we have them in the hospital that we can give to you too. So if that's something you're interested in, you can ask your nurse and be like, hey, I really want to use my peanut ball. I really want to move a lot in different positions. Can you help me do that? Or I know you're busy, but can I have that set up ahead of time so that I don't need to bug you? And that's definitely something we can facilitate for you as well. Yeah.
Yeah. That's great. I love knowing that, good nurses are part of your birth team. They're rooting for you. They're on your team. They're there to help you work through all of that stuff. it's gold. It's so good. When
Yes,
you find a good nurse, it's like so, it changes everything. It's so good because they're the
it
one that ends up
does.
spending the most time with you, particularly if you are with an OB. Like your nurse becomes your support person. So it matters.
Exactly,
Yeah,
exactly. It matters. It's a huge, huge thing because sometimes, you only see your obstetrician at the very end because they're also really
right.
busy. They're sometimes running to the emergency department, going from delivery to delivery, and you actually only see them for, you know, the last 30 minutes of your whole entire labor and delivery process. So the nurse and, if you have a doula or again, the importance of your birth support team, that is huge because those are the people who you're going to be with majority of the time.
Yeah. Okay, here's a question that I know many moms are worried about. What if I poop during labor? Can we talk about that?
Oh yes, the dreaded poop. I make so many videos on this because I just every single person is so worried about pooping and it's like it's so funny to me because I don't even think twice about it. At this point,
hmm
I've seen so many deliveries and like 90% of women poop, like honestly. And poop makes me happy. If I see my patient pushing really well and there's a little bit of poop, I'm like, yes, this girl's doing it right. She's pushing in the right spot. Like
Yes.
that makes me so happy. And I make sure no one else sees the poop. Like I have a way to like clean it up really discreetly. Like it's really not something you need to stress about. I know you still will. I know, like, if I was the patient on the other end, I probably would be worrying about it too. You don't want your partner to see that. You don't want people to just see that. But at the end of the day, what's most important is that you're safe, your baby's safe. And if a little bit of poop is involved in that, it really doesn't matter. Another thing I want to say is sometimes it's baby poop as well. It's not just mama
Mm,
poop. So
yeah.
babies poop too. And sometimes they poop before they're born. So you'll have some poop in the fluid that comes out as well. So birth is just a little bit messy. It involves lots of fluids and it's just a part of the process. And it's something you have to just try to remind yourself that it doesn't matter. And you're not going to remember it at the end of the day. Your partner's not going to remember it either. All they're going to be focused on is the fact that you just delivered a whole human being and that you are a superwoman, truly.
100%. I have not been to a birth
Yeah.
yet where somebody was like, I cannot believe how much you pooped after they have their, let's talk
Right?
about that. Nobody says that.
I know. I know. I literally was talking to someone before and I was saying they think that we take out the poop, we weigh it like the baby and do all of these things. And it's like, absolutely not. Like we forget about
No,
that as soon as it happens. No one talks about
totally.
it. No one thinks about it. It's just a part of it. It's not something to stress about for sure.
Yeah. Yes, I agree. Something else, there was another, again, one of your Instagram posts that I was looking at, and it was like 3 things that you shouldn't worry about from a labor and delivery nurse. One was poop. The other, you were talking about shaving, which I was like, oh, that is such an important
Yes.
one. Cause I mean, even me, like early labor, and I'm like, gotta get these legs, you know? And then the
Right.
downstairs too, cause you're like, people are going to be seeing this, but it's just not like that, right? Like it's not nobody is thinking twice about any of that when we're talking about having a baby.
It's so true. And this is another thing so many people stress about is the shaving, the pedicure, did they have a chance to
Yes.
get their toes done? And it's like we don't care. Like I had a patient actually yesterday who was like, "I'm so sorry. I didn't have time to get a wax or whatever." And I was like, "Girl, I didn't have time either. It's okay. Like it's not a big deal. Like we're human. Like we've seen it all. Literally, we've seen it all. And at the end of the day, it really, really, it's not something we're like, oh my gosh, did you see? She did not shave her legs. Like, no,
Yeah.
that
Yeah.
doesn't matter. We also probably haven't shaved our legs. We're busy. We're humans. Like, it's not a big deal. Like, don't even worry about it. Yeah.
All right. I want to end. I have one more question. This one came from Instagram, and she was asking, how soon after birth does mom need to pee before it becomes concerning?
Yeah, that's a great question. So sometimes after birth, people do have trouble going to the washroom. It's pretty common, especially if you've had a catheter put in, so a Foley catheter, which drains your bladder. So some people need that if they've had an epidural and they can't pee on their own. We will put in a Foley catheter. or if they've had an extreme amount of swelling down there, sometimes it prevents you from being able to pee. And then if you've had a C-section, we always put in a Foley catheter to drain your bladder throughout the surgery. That's to make sure we don't have any like injuries to your bladder during surgery. So it is something that we definitely keep an eye on, and you need to be able to go to the washroom on your own before we send you home, obviously. So usually we give you about 6 hours to actually pee on your own. This again varies a little bit from hospital to hospital. So some people say, you know, you have 8 hours until we intervene. But I usually try to get my patients up into the washroom within a few hours after delivery to see if they can actually pee on their own. Sometimes this can be a little bit challenging. You might need to run the water, like the faucet. I've heard that putting peppermint oil in the toilet bowl is another way that people actually, it helps them to pee. So there's all kinds of little tricks, you know, using your Perry bottle down there. The warm water helps to stimulate you to actually go to the washroom. But this is something that can be challenging after. So if you're feeling like, oh my gosh, I am not peeing right away, don't worry. We have tricks up our sleeves to help you to be able to pee. And at the end of the day, if you know you're not able to void on your own for any reason, what we'll do is we'll probably do what's called an in and out catheter, where we stick a little tube into your bladder, we drain your bladder, and then we take it out. So it's not something that stays in. It's just to make sure that your bladder stays empty, because an empty bladder helps with your bleeding postpartum as well. So if you have a really full bladder, it's hard for your uterus to contract down and prevent any of that bleeding. So we want to make sure your bladder is nice and empty. So that's why we'll really probably focus on getting you up and going pee frequently after you've had a baby. Even during labor, sometimes we want your bladder to be quite empty as well too. So yeah, it's something that it doesn't quite become concerning until it's been 6-8 hours of you not being able to go to the washroom, or if your bleeding's quite heavy, we might insert a catheter at an earlier time. Yeah.
Okay. And then how about bowel movements? That was the second half of that question. Like, how soon do you need to have one, and any tips for making it as easy as possible?
Yes, the dreaded postpartum poop. I know that a lot of people stress about this, especially if you're super regular ahead of time. Like if you're going to the washroom once, twice a day before birth, it's not abnormal to not be able to poop for a few days after you've had your baby. So that doesn't really become concerning until it's been like 3, 4, 5 days of you not being able to go to the washroom. Usually we'll give you like a stool softener or something to help kind of your bowels to soften before you actually go to the washroom. We'll even sometimes prescribe a laxative too. But this is why it's also important to keep your fluids up when you're postpartum. So drinking lots and lots of water, and then those healthy foods. So like the fruits, the veggies, the stuff that's high in fiber to help your bowels to start moving. It becomes really difficult to move your bowels, especially after you've had abdominal surgery. So if you've had a C-section, it's going to probably be a little bit more challenging. But on the other side of that, if you've had a vaginal delivery with a tear, that's when people get really scared to go to the washroom, right? Because they don't want to irritate anything down there. But that's when, again, having lots of water, stool softeners to soften everything up, that's going to help a lot. There's all kinds of tricks you can do too. Like you can take a pad and fold it up and kind of press it down on your perineum while you're going to the washroom. And sometimes that helps, that counter pressure while you're actually going to the washroom. So there's things that your nurses will talk to you about on ways to be able to go to the washroom. But I think the fear of going is almost worse than when it actually happens for most people. So keep that in mind. It's not as bad as it seems in your head, if that makes sense. Yeah.
Yeah. I'd say that's similar to the fear of labor if you've never done it before. You know, you like work this up in your head. How's it going to be? But then you do it and it's okay. So
Exactly. Yeah.
Well, Nurse Sydney, thank you so much for your time today. Will you let everybody know where they can meet you and connect with you online or anywhere, all your social medias and all that stuff?
Yes. If you guys want to follow me on all of my accounts like TikTok, Instagram, Facebook, I'm just at nurse_Sydney. So it's the same across all my platforms, nurse_Sydney, and you can find me there. Yeah. Thank you so much for having me.
Thank you for being here. And for everyone listening, we'll make sure we'll put all of those links in the show notes so that you can connect with Nurse Sydney and go enjoy her channel, just watching all of her fun videos and getting education along the way. So thank you so much.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.